H3N2 Influenza. H3N2 is a subtype of the Influenza A virus that can cause respiratory illness in humans. In this article, we will discuss in detail about H3N2 diseases, its symptoms, transmission, diagnosis, treatment, prevention, and outbreaks. Symptoms of H3N2 infection. The symptoms of H3N2 infection are similar to those of other influenza viruses and may include fever, cough, sore throat, body aches. Transmission of H3N2. H3N2 is transmitted from person to person through the air when an infected person coughs, sneezes, or talks, or by touching a surface contaminated with the virus and then touching the mouth, nose, or eyes. Diagnosis of H3N2 infection. H3N2 infection can be diagnosed through laboratory testing, which involves taking a sample of respiratory secretions, such as nasal or throat swabs, and testing it for the presence of the virus. Rapid diagnostic tests are also available that can provide results within a few minutes, but they are not as accurate as laboratory testing. Treatment of H3N2 infection. Most people with H3N2 infection will recover without needing medical treatment, but in some cases, antiviral medications may be prescribed to reduce the severity and duration of symptoms. Prevention of H3N2 infection. The best way to prevent H3N2 infection is to get vaccinated against the flu each year. The flu vaccine is updated annually to include the strains of influenza viruses that are expected to be circulating during the upcoming flu season, including H3N2. Outbreaks of H3N2. H3N2 has been responsible for several flu outbreaks and pandemics in the past, including the 1968 Hong Kong flu pandemic and the 2017-2018 flu season in the United States. The 2017-2018 flu season was particularly severe, with H3N2 being the dominant strain circulating in the United States. Conclusion. H3N2 is a subtype of the Influenza A virus that can cause respiratory illness in humans. While most people with H3N2 infection will recover without needing medical treatment, the virus can be severe in some cases, particularly among older adults and young children. The best way to prevent H3N2 infection is to get vaccinated against the flu each year and to practice good hygiene habits, such as washing your hands frequently and covering your mouth and nose when coughing or sneezing.